suddenly she couldn't move her left foot. She started looking up her symptoms and then got into the Google rabbit hole. She was terrified. She looked me in the eye and said, "Dr. Takem, you didn't hear me. I was the doctor, but I wasn't her ally. She deserved better." I had failed her. A patient does not care how much you know until they know how much you care. Who is looking at you? The whole you. Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. Camila walked into my clinic, terrified. Now, she had been Googling her symptoms over the weekend after a terrifying event happened to her. She told me she was trying to walk to the kitchen and suddenly she couldn't move her left foot and she almost fell to the ground and had to support herself on a chair that was nearby. And she started looking up her symptoms and then got into the Google rabbit hole. So by the time she got to the clinic, she was terrified. She got diagnoses like ALS, a stroke, etc. Now I did my job. I did the physical exam. I checked her reflexes and tested her gait. Clinically, I knew she was safe. I reassured her and sent her home. But unbeknownst to me, because Camila has a PPO and she doesn't really need my permission to see a specialist, she walked right out of my office and straight into a neurologist's clinic. She was looking for the safety I failed to give her. So she went through the gauntlet: EMGs, nerve conduction studies, blood panels for rare vitamin deficiencies. Everything came back normal. The neurologist told her she was fine, just like I did. But when she came back to me, she didn't feel relieved. She felt medically gaslit. She looked me in the eye and said, "Dr. Takem, you didn't hear me." Even though I was right, I had failed her. I was the doctor, but I wasn't her ally. She deserved better. Now, I trained at Jamaica Hospital in Queens, New York, and there is a sign in the ER that I still remember to this day, and it has been sort of my guiding principle in my interactions with patients. And this sign said clearly, "A patient does not care how much you know until they know how much you care." Now, I have tried to practice that mantra as much as I can, but this encounter with Camila took it to the next level because Camila taught me it is a clinical requirement, not just something nice to have. In the world of PPOs, you can see any specialist you want. You can go to the neurologist for your foot, the cardiologist for your heart, and the gastroenterologist for your stomach. But who is looking at you? The whole you. Specialists are trained to find broken parts. They focus on body systems, on certain organs. If they don't find a broken nerve, they tell you, you are fine. But the primary care physician is supposed to be the quarterback, and that is where I failed Camila. If I don't provide the emotional and clinical certitude to catch you when you are falling, then all my medical knowledge is just noise. That is why I created the daily brief, to be the quarterback the system has deleted. And that is what Camila needed on that fateful day. Now let's talk about the science of what Camila was feeling, because if you understand the why, you don't have to fear the what. So foot drop is simply the inability to lift the front part of your foot. It's terrifying because Google tells you it's ALS or a stroke, and we live in an era where patients tend to Google their symptoms. much to the chagrin of doctors, but sometimes patients need safety. When they Google their symptoms, the results might terrify them or might calm their nerves. Now, it has created a whole new set of issues that we as a healthcare system need to address. In this case, if you Google foot drop, you will find terrifying things like ALS or a stroke. Now, trust me, because I did it. I went up and looked up all the symptoms that Camila told me and looked at the top 10 reasons, and it was truly terrifying. And this is what makes her story even more representative of the healthcare atmosphere we doctors have to practice in 2026. So as a clinical detective, I looked at 3 specific levels when she mentioned a foot drop. The first thing is the peripheral nerve. That is the peroneal nerve. This is a nerve that lies right near the surface of your knee. If you sit with your legs crossed for 3 hours, you can actually put that nerve to sleep, just temporarily. But it's common and it's reversible. I have experienced it several times. When I started out my career in podcasting, I would usually sit with my legs crossed, especially when I had interviews with a guest. And very often, after a 20-30-minute conversation with a guest, we wrap up, we say goodbye, and I stand up to turn off the cameras or talk to my technical team, and I can't walk because my right leg just won't move. And that is a peroneal nerve going to sleep. I'm pretty sure it's happened to a lot of people. And now I've had other situations where patients came to see me after getting off a plane where they were doing the same thing. They were sitting, cross their legs, were reading a book. At landing, they couldn't walk. And so after they get off the plane, they come to see me in the clinic asking, "Doc, is this normal?" Now, the second thing is the L5 nerve root. This is in your lower back. You can have a silent herniated disc that really doesn't cause any back pain at all. And I know people always wonder because a herniated disc is supposed to cause back pain. But in this case, it can be silent and it can pinch on the nerve that controls your foot, leading to a foot drop. Now, the other thing to consider is the central nervous system. So this is your brain and your spine. This is what we rule out first to give you peace of mind. Because remember, the brain and the spine control all movement in the body. Literally, the central nervous system tells your muscles which part to move, the arm or the leg. Your nervous system controls movement, whether you want to move your left arm, right arm, or your left foot. Okay? Next, we can use things like EMGs and nerve conduction studies. The nerve conduction studies, also known as NCS, is like checking the wiring in your house by sending a pulse through it. The EMG is like putting a microphone to the motor, the muscles, to hear if it's getting the signal. For Camila, these tests were performed by the neurologist, and these were normal. But normal isn't a cure for fear. So my job was to explain why they were normal and what the next steps were. Instead, I just gave her a conclusion without the conversation. Basically, the proverbial pat on the back, and I sent her on her way with a smile. And that was wrong. Now, the PPO model is a double-edged sword. It gives you freedom to see whatever specialist you want, but it often leaves you without a home because you don't need a referral, but you end up in the specialist offices where they don't know your history, your fears, or your family. And very often, as it should be the case, specialists are really focused on the specific clinical question. That's why usually it's a better idea to go to your primary care doctor, let him first evaluate you, and then send you to a specialist with a specific question so the specialist can focus your presence in his office that day to answering that question rather than going on a fishing expedition. Now, on the other hand, I can see how that is empowering for patients to know that they can take care of certain problems if, for instance, they have a disagreement with their primary care physician. And that too is a justifiable course of action. And then there is the 15-minute factory. The way health insurance companies reimburse physicians has kind of obligated physicians into 15-minute appointments. Your insurance company pays for efficiency. They want us to see 25 patients a day. Now, in that rush, reassurance becomes sometimes dismissal. So when I say you are fine, I am trying to be efficient, but to Camila, I was being dismissive. So we have to break the factory. We have to bring allyship back to the center of the room. The doctor and the patient as allies towards fostering an environment where the patient can thrive and their health can be taken care of. This show is my way of giving you the hour-long conversation that the insurance company won't let us have in the clinic. Now, just a sidebar. If you are in the DC or Maryland area, you know how hard it is to find a doctor who actually sits down. At Maryland Primary Care and Wellness, we've made a choice. We've chosen the Jamaica Hospital philosophy over the insurance factory. We don't just treat symptoms. We treat Camilas. We treat people who are looking for safety. If you want a clinical partner who hears you the first time, visit us. Let's change how you experience medicine. Tomorrow, we are going to talk about the canary in the coal mine, your liver enzymes. I'm going to show you why a borderline lab result is often a cry for help that the system ignores, and tell you what do we actually do about these cleanses and detoxes. You don't want to miss that. Thank you for trusting me with your time today. If you've ever felt like Camila, right but unheard, share this episode. This is the Daily Brief, high-level science, human-level care. I'm Dr. Albert Takem. See you in the clinic.